Take it away.
All right. Hi, everyone. My name is Allison, and I'm one of the volunteers over here at Southern California German Shepherd Rescue. I've got Mr. Mikey in my lap. Look at this. Look how healthy he is now and spoiled rotten. So I'm going to talk a little bit about Olive's condition and the surgery that they did to fix it, because human anatomy is what I do. I'm not a DVM, and I'm certainly not a doctor because I don't work with living patients. But what I can do is explain the structure of the heart, the blood flow that is supposed to be happening while you're in the womb, and what happens when you are born. And then I can also talk about what they did with Olive's condition to fix it. As some of our bunny dogs are barking in the background. I love Juliet. So, look, that's okay. Look, Mikey's like, Marcy, come back. I love you. All right, so let's talk about heart structure. Now, your heart has two sides, a right side and a left side. The right side of your heart pumps blood to your lungs so that you can do gas exchange and move oxygen into your body so that you can feed your cells, and move carbon dioxide out of your body because carbon dioxide is a waste product. The left side of your heart takes the blood from your lungs and sends it to the rest of your body so that your body can get that blood that has a high oxygen level. Now, what happens in the womb is that you're not breathing, and so your lungs don't need a lot of blood flow. They actually just need a little bit of blood to keep them nice and healthy so they can develop. But your oxygen is all coming from your mom's placenta, and that's true for humans and all other mammals such as puppy dogs. And so what happens during the gestational period, which is when you're in the womb developing, is that some of the blood goes to the lungs to make sure that they can develop properly, but a lot of the blood actually just goes straight to the body so that your cells that are growing as you're developing can get enough energy for them to do all their normal jobs. And what happens is that the right side of the heart has a big blood vessel called the pulmonary artery attached to it, and that sends blood to the lungs. And the left side of the heart has a large blood vessel called the aorta attached to it, and that sends blood to the rest of your body. Now, since you don't need to send blood, or at least very much blood, to your lungs during development, some of that blood actually gets rerouted right to the aorta. And that happens through a little passageway called the ductus arteriosus. And the ductus arteriosus allows you to send just enough blood to the lungs, but actually just move most of the blood to the body so that the baby can get the proper amount of oxygen to all of its cells during development. And no, so normally what happens is as you're born, when you take that first breath, it actually shuts down the passageway between the pulmonary artery and the aorta, that ductus arteriosus. So normally the ductus arteriosus is nice and big, blood flows through it from the pulmonary artery to the aorta, and you don't worry about having much blood in the lungs. As soon as you start taking that first breath and your lungs fill with air, your body's like, oh, I need to make sure that I get air from the outside instead of from my mom's placenta. And what happens is that ductus arteriosus goes from this to this and shuts down so that the proper amount of blood goes to your lungs so that you can get proper gas exchange. And then blood goes back to your aorta through the left side of the heart so that all your tissues can get fed. Now, in certain children and certain puppy dogs, what happens is that the ductus arteriosus doesn't close, and it's called a patent ductus arteriosus, or a PDA. And that's unfortunately what happened with Olive. So instead of going from this to this, the ductus arteriosus stayed open. And so Olive's heart had to work overtime because it needed to send extra blood to the lungs since the right amount of blood wasn't actually going to the lungs. So Olive's little heart actually got too big because it worked too hard, and she developed something called left ventricular hypertrophy and developed a heart murmur. And so as soon as Mikey is very, very bored by all this.
He's moaning and groaning.
Yeah, Mikey's like, why isn't the attention on me? Well, I'm sorry, buddy. It's not going to be. So basically what happened with Olive is that when she was brought into the rescue, she was very ill, and the doctors listened to her heart and they realized she had a problem. She had fluid in her lungs called pulmonary edema, her heart murmur, and she also had an enlarged heart. And these are all problems that were associated with having that PDA, that patent ductus arteriosus. So again, the blood flow wasn't going to the lungs like it should have. It was bypassing the lungs and going to the rest of the body. And if that had occurred, if that had kept occurring for a few more days, even, Olive actually could have gone into true heart failure and just died because she wasn't getting enough oxygen to her body and her little heart was having to work too hard. So, what the doctors did is they actually made an incision along Olive's side and then another incision here for a chest tube. They went in with surgical instruments and they actually sealed off that ductus arteriosus. So now she's getting the right amount of blood flow to her lungs and to the rest of her body, and that's actually taken a lot of the work off her little left ventricle. So what we're hoping is that over time, as Olive grows and has a nice healthy blood flow, that she's going to have very minimal problems. And hopefully as she grows up, her heart's going to get a vacation essentially from all that extra work. It'll go back to its normal size, or as she grows, it's not going to overgrow, and she's going to resolve or grow out of that heart murmur. And for the next year or so, she's definitely going to have to go to a cardiologist and check out that heart to make sure everything's going okay. She needs to be on antibiotics for the next few days because we need to make sure that there's no infection along that incision. And we've also got to keep her nice and calm for the next 10 to 14 days because we have to give time for all of that stuff that they fix to actually heal up and form scar tissue. So poor little Olive is going to have to stay in a crate for 10 days, which is going to be hard for her because she's a terrier and has tons of energy. But hopefully by keeping her nice and quiet for the next couple of weeks, we're giving her a much better chance at having a nice, healthy life when she goes to her forever home.
What is the chest tube for?
The chest tube basically was draining fluid out of her lungs because she had some lung problems. So the chest tube actually reinflates the lungs after they've collapsed.
Okay. So it just allows her to be able to fill her lungs with oxygen, and then any extra fluids in her lungs will drain out the tube.
Exactly.
Okay.
Yeah. So that's why the chest tube came out right after surgery.
Oh, it came out. It's already out.
Oh, it's gone. Yeah.
Oh, okay.
Yeah,
Because I was confused because Ronan had all those tubes in his stitching,
right.
You know,
the drainage
tubes. So
yeah.
That's different than a chest tube.
Yeah.
Okay.
Yeah, the chest tube is used to actually pull air or liquid out of the lung cavity, the pleural cavity, and basically pull the lung back open so that they can breathe normally.
That sounds painful.
Well, fortunately, she was heavily sedated.
Oh, okay. So during the surgery, her lungs collapse?
I think that they do when they have to do that surgery.
Yeah.
Yeah.
Oh. Yeah, it's a very it needed a specialist.
Yes.
And Dr. Surdi is a heart specialist, and he's also an orthopedic specialist. And miraculously, I don't know, it's pretty unbelievable that 6 weeks ago he called and left a message on the rescue phone that he was willing to do our surgeries for us for half price.
Yeah.
Because half price is still going to add up to $4,000 or $2,000 for his part of the surgery.
Right.
That's not including the cardiologist.
And all the follow-up work.
Yeah, and it's just like he came out of the blue knowing Olive was coming down the line or something, because Dr. Tugin would never have attempted that surgery.
Right. It's not an easy surgery.
Right.
And, you know, it's pretty amazing that we were able to get the fundraising for Olive within just a few days. So thank you to everyone out on Ustream and Facebook and whoever else donated. Mikey's very happy. Well... Mikey's very relaxed, but he's clapping because we couldn't be able to save little dogs like Olive, even though she's not a German Shepherd, and we certainly couldn't save little dogs like Mikey here without the really generous support of everyone who's pulling for our dogs.
Yeah, it really is amazing the response that we get from people. Every time we take a dog and we commit to getting the dog whatever it needs, these surgeries, we never know if this will be the last dog, if we'll be able to raise the money, if everybody will go, oh, well, you know, yeah, we're over it, go on to something else. But everybody responds consistently, and we've been able to help these dogs. And our money coming in is just about almost exactly the same as our money going out every year.
Yeah.
And without our great volunteers, we wouldn't be able to continue to do this. And without our supporters, we couldn't help it. Mikey would not be here today. Olive would not be here today, and so many of the other dogs we've helped this year and since 2006. So, and we plan to have a really good year next year.
Yeah. So give us money. It's tax deductible.
Okay. On that note, we'll stop our recording.
Thanks for listening. Oh.